各位记者朋友，大家晚上好，欢迎参加成都市人民政府新闻办公室新闻发布会。
Dear friends
12
from
月
the
7日，
media,
我市
good
郫都区
evening.
发现新冠。
Welcome to the press release by the Information Office of Chengdu Municipal Government. This is the third day since we have identified a positive case, and we are trying our very best to contain this epidemic. And today we have with us person in charge from relevant districts to update the situation and also answer your questions. And we have with us Xie Qiang, who is the Director of Health Commission of Chengdu, and Liao Xiaobo, District Mayor of B2 District, and District Mayor Wang Huayong of Chenghua District. May I first give the floor to Director of Health Commission, Mr. Xie Qiang of Chengdu. Dear friends from the media, good evening. Let me first update you about the latest situation. Yesterday, as today there is no new case of COVID-19 in Chengdu as of 6:00 p.m. today. We have 6 positive cases, 1 asymptomatic case. All the 7 patients are hospitalized at the Chengdu Clinical Center. Each patient is assigned with a team of doctors. All of them are in stable conditions. As of 6 p.m. today, we have traced 433 people with close contact, and 38 of them have shown a negative result. Already we have dispatched more than 2,000 doctors to take the NAT, and we have covered multiple districts in Chengdu. For today, we have collected the samples of 483,000 for NAT. Already 399,000 people have completed the nucleic acid test, and we have 14 positive cases, and most of the cases sampled are showing a negative result. On December 8, we have stepped up the capacity of NAT. Also, we are stocking up materials, and we have streamlined the different risk assessment capacities, and already our effort has covered 669 organizations in the city. I'm with China Media Group. I want to ask a question to the District Mayor of P2 District. Can you brief us about the latest updates? Over the past few days, we have engaged in the following efforts. First, we have continued with our epidemiological survey, and we have continued with the effort of contact tracing. As of today, we have traced 134 people with close contact with the positive cases, and altogether 310 people have been traced, and all of them have conducted a NAT and all of them have shown a negative result, and they have all been relocated to a designated hotel for isolation. And today, we have conducted another nucleic sampling for all those with close contact with the positive cases. And we will continue with this NAT and contact tracing. And on the evening of December 8th, we have basically covered 8 villages and residential communities in 2 districts. On November the 9th, we expanded the area of nucleic acid test. We are now covering middle and primary schools, kindergartens, private clinic centers, agriculture markets, and also transportation centers. All the practitioners in those sectors and industries are covered by our NAT efforts, and as of today, we have taken a sample of 369,000 people, and 90% of these people have been tested, and we have identified 5 positive cases, and all the remaining samples show a negative result. And third, we have strengthened control over medium risk areas. And today, the Division 8 of Yun'an village of Tangchang Town was designated as a medium risk area. It has 129 households. We have dispatched 6 party cadres to put in place enclosed management of the village. We also organized 22 volunteers to provide life-related services and mental support to the villagers in isolation. We are also disinfecting the village and also transporting the life-related garbage to a designated area. Fourth, according to the arrangement of the city, we have organized a team of 70 people who are in 7 teams, and they are investigating 580 organizations of the city, and we have traced more than 60,000 people, and 26 are from the Taiping village, and most of them have shown a negative result for their NAT. We also dispatched community-level cadres to engage in a very thorough investigation in their jurisdictions and also follow through the requirements on epidemic control and prevention in autumn and winter, and also do a better job in personal health. At present, we have sufficient supply, and the price is also very stable. Thank you very much. I'm with China Economic Daily. My question is directed to Deputy Mayor. As we know that currently only 2 districts have registered positive cases, and what are you doing with epidemiological service? Thank you very much for your question, and thank you very much for showing your support to my district. On the evening of December 7th, after notified by the municipal level of Health Commission, we have traced the movement record of Mr. Zhao, and this movement record covers the duration of December 3rd to December 7th. He's visited a couple of places, for example, restaurants, cinema, and bars, and also a bar named Playhouse. So we immediately organized a team of 230 policemen and locked down those places. And we also disinfected those places. After 2 days and 2 nights of efforts, we organized hundreds of epidemiological practitioners and sample takers, and with their efforts, as of 6 p.m. of December 9, which is today, we have traced 272 people with close contact, and all of them have been put into isolation, and they have submitted their samples of nucleic acid, and most of them have shown a negative result. And as of today, Jinjiang District has conducted a NAT covering 350,000 people, and almost all the samples have shown a negative result. And because we are a district filled with many different businesses, so we are mainly covering Taiguli and Chengdu district, and also the seafood market. We're strengthening control in those areas. As of present, a lot of the businesses, they are still running as usual, and we have immediately published a notice on strengthening epidemic prevention and control, and we have laid out our plan to engage in epidemic preventions. And for major shopping malls, we are taking temperatures of the shoppers. We are also putting in place sanitizers and disinfectants, and we are also disinfecting in those places. We are also monitoring the health conditions of the staff working in those shopping malls, including taking their temperatures and also checking if they have some symptoms such as dry cough or short breath, and if there is any such symptoms, they will be transferred to a nearby hospital. And we are watching also closely over those seafood and fresh food transported through the cold chain system. In so doing, we also are very determined in preventing those with symptoms from working on their post. We are doing a lot of fundamental works. Whenever we identify a problem, we're going to see to it that the problem will be solved, and also those who have to be tested will be tested, and we are covering the staff working at major shopping malls, and this is what I can tell you as of this point of time. Thank you. So my question is directed to the district mayor of Chenghua district. So can you tell us the latest in your district? Thank you very much for your question. As you have mentioned, at 9 o'clock yesterday evening, the Yunjingtai residential community in Huadu area of Cuijiadian was designated as a medium risk area. It has been 24 hours. Over the past 24 hours, we are putting epidemic control as a priority. Yesterday evening, district party secretary conveyed a emergent meeting. We studied the guidelines given to us by the party secretary of Chengdu, and we are making another deployment and plans according to the result of the epidemiological survey. We identified and located the address of the positive case, which is the Yunjingtai community, and also a small bar. We are working with 3 designated teams. We are all on this, and we are committed to locating those potential people with contact with the positive cases, and we are working very hard on managing hotels and bars and relevant places that were visited by the positive case, and we are taking effective measures, and we believe that we can contain this epidemic at a very early stage. At present, we are putting in place effective control over relevant personnel. We are still doing epidemiological surveys, and NAT, different sectors of the district, are strengthening their routine prevention and control of the epidemic. We are maintaining sound social and economic order, and our efforts mainly cover 4 areas. Number 1, we have immediately initiated a contact tracing and epidemiological surveys according to the general planning of the Chengdu city. Today, we dispatched more than 1,000 personnel in epidemiological surveys and NAT sampling in Wuhou district, Chengdu district, and Longtianyu district, and Qingbaijiang district. In Quyang district and Shuangliu district and Tianfu district, we have dispatched altogether 70 epidemiological staff and more than 300 doctors who take samples as of 6 p.m. Today, we have traced 137 people with close contact and 200 people with medium-range contact with those positive cases, and we have put in place isolation measures and also NAT for those people. And yesterday evening, we disclosed 91 person with close contact with positive cases, and 838 people with general contact with those positive cases. And with continuous efforts, we have identified 46 new personnel with close contact with the positive cases and 12 people with general contact with those positive cases. According to our survey, at 12:30 this noon, we expanded the scope of free NAT, and now it's covering all the business shops in near that nightclub, and also the neighboring residential communities of Yunjingtai community. And because one of the nightclubs is very close to Chengdu University of Technology, and that university has a lot of youth. They have a lot of overlapping movement records. Considering this, we are designating the university as part of our NAT efforts. We have established more than 100 NAT sites to ensure that the 50,000 teachers and students in the university are tested, and we expect that before 24 o'clock this evening, all of them will be tested. From 6 p.m. yesterday to 6 p.m. today, we have expanded the NAT test to more than 65,900 people. From yesterday up until present, in our district, we have covered 680,000 people in our NAT efforts, and we also collected 32 environmental samples. At present, all the results are negative. Second, we are strengthening the enclosed management of key communities. The Yunjingtai residential community has 392 households with a total population of more than 700, according to the general plan of the State Council Joint Prevention and Control Mechanism. Over medium risk areas, we are strengthening the enclosed management of the residential community. We have closed off the public facilities of the community so that we can avoid people gathering in certain places. And each and every day, we are conducting at least 2 disinfecting in their community. We're leaving no corners behind. In the meantime, we are also actively monitoring people's health conditions and also providing the residents with mental support. We have dispatched specific staff to deliver daily necessities to their doorsteps. We're working together with relevant supermarkets to enable orders placed on WeChat. We are providing customized services to those communities, and after the 14 days become due, we are going to conduct another NAT for all the residents. At present, the management is well underway, and the community is in a very stable condition. Third, we will do a very good job in epidemic prevention and service in those hotels under isolation. We're following a very prudential principle. We have already designated 4 hotels as hotels for designation, as hotels for isolation, and they have altogether more than 600 hotel rooms. And if needed, we are able to mobilize 4 hotels within the next 24 hours. Whenever we identify a person with close contact with the positive case, we will put them in those hotels. And according to the relevant requirements in epidemic control and prevention, we are putting together very stringent measures. And in the meantime, we are also providing very customized services to those in isolation. We also provide them with customized services so as to ensure that their life is guaranteed. In the meantime, we are also providing them with mental support so that those who live in isolation are in a good state, both physically and mentally. Fourth, we will continue to do a good job in epidemic prevention in key areas, and this covers hospitals, residential communities, schools, cold chain, logistic centers, public places. In those places, we are strengthening ventilation and control, and people have to wear a mask. Disinfection must be conducted regularly, and designated personnel will be dispatched to those places. And starting from yesterday evening, according to the general deployment of the city, we have covered 799 medical organizations in Chenghua district in our investigation. And this includes 63 hospitals and clinic centers and 670 clinic facilities and 46 outpatient service centers. And it also includes 23 other types of health organizations. For those loopholes and potential risk areas that we have identified, we put in place rectification measures, and for those who are not able to correct and close the loopholes, we will give a time window for those places to come up with relevant solutions in a timely manner. Going forward, the district government will take effective measures to guarantee that all the measures are put on the ground. We believe that with those efforts, we will claim a final victory against this epidemic. And here I would like to give a friendly reminder to those who have visited the Yunjingtai residential community over the past 14 days to actively report your movement record. If you have close contact with any of those positive cases, you need to be responsible for this city, for your family members, and also for yourself. You are kindly advised to take a nucleic acid test. At present, in Chenghua district, we have already 2,927 people who took the initiative in NAT, and all of them have shown a negative result. And here I'd like to advise that people who are willing to take the test go to the test centers. Thank you very much.
由于时间关系，现场提问就在这里。疫情出现后，我们坚决践行人民至上、生命至上的理念，及时采取行动。Due to time constraints, this is the end of Q&A session. So since the epidemic broke out, we put people's health in the first place. We are weaving a network of epidemic control, and we will keep you posted when there is any new development of the situation. And with your support and coverage, we've seen those medical staff who are fighting on the front line, and we've seen a lot of people who are working on their post. And the speakers today, they have been working very hard, and so thank you to all of you.